So what is typhoid? Typhoid fever is a result of systematic infection caused by Salmonella typhi found only in men. It is an infection that spreads through the contaminated food and the contaminated water. The symptoms include high fever, headache, stomach pain, weakness, and loose stools. What causes typhoid? Salmonella typhi is the major cause of typhoid. It is contracted by the ingestion of contaminated food and contaminated water. How typhoid is diagnosed? So a diagnosis of typhoid fever can be done, usually be done by analyzing the samples of blood, poo and pee. That is the urine samples and the stool samples. By analyzing them, we can diagnose the typhoid. These samples are examined under the microscope for the Salmonella typhi bacteria. Since it is microscopic and too small, the bacteria aren't diagnosed at the first time. They may not be able to detect it at the first time. Now the treatment for typhoid. Antibiotic therapy is the only prescribed treatment for typhoid fever. The commonly prescribed included azithromycin and ciprofloxacin. Now, how common is typhoid fever and where it is found? Now, in India, typhoid is an endemic fever. In US, it occurs 400 cases annually and it occurs mainly by the traveling that causes internationally. How typhoid is transmitted? An infected person can pass the bacteria out of their body, in their poo or less commonly in their pee. If someone else eats the contaminated food or drinks, there is a chance of them getting infected by typhoid fever. Steps to reduce the risk for: wash your hands, avoid drinking untreated water, avoid raw fruits and vegetables, choose hot foods, know where the doctors are. Now the national program. So the Integrated Disease Surveillance Program or IDSP is a program which covers 22 diseases including typhoid fever. So that's all about typhoid fever. I hope you are well thorough with the typhoid fever and its